I'm really looking forward to talking to Craig, though, because he's got quite the story.
He has quite the story. But our first question is basically a week later since we first heard from you, Craig. How are you doing?
I'm asymptomatic. I don't have any fever. I don't have any lung problems. My temperature is normal. I've had 2 tests. I'm waiting for the results, and they are the CPR, which is poly chain reaction. And I need 2 of those negative tests in a row in order to be released from the hospital.
Okay, you still haven't had those yet.
I've had the test, but I'm getting the results hopefully in 2 days. The tests were 4 days ago. It takes 2 or 3 days for them to go to the lab and then give me the results.
Okay.
It's really quite comfortable. Unlike the ship, where we were confined to our rooms a lot, and we were given permission to go outside once a day for an hour at a certain time, I can wander the corridors of this hospital, the 5th floor only, anytime I want. The nurses have with them an iPad which has a translator on it. So if we want anything they don't understand, I speak into it and then I get the answer from them through the computer. The first one is we have to get, as I mentioned before, 2 negative results. Then we have to get a certificate of health from the hospital showing this. Then we have to sign a form for the Canadian Embassy, which we sign and then send to them. And then finally, the 4th step, they will give us a certificate of health from the embassy, and that allows us to fly home.
That's a lot. I'm listening to you as you tell us all of this, and obviously it's an ordeal. But you seem to be really taking it well in stride, Larry, as I look at things, Craig.
I'm your happy healer, Keith Landy, for President of the United States of America. I'm very concerned about our recent times. It seems like everything is against the ordinary American. Let me tell you, I've spent so much time myself getting prepared for this very run, and I've got so many talents to offer the American people, and I give you my all. I give you all of myself. The fact that I've ran bus companies and understand businesses, and I get quite a bit. And the fact that I'm quite good at what I do, because I care, and because my motivation is love and passion. And that despite all of that, in the world of when I call it, and I do mean it, greed hell, that the greed hell itself seems to hold us back. How uncanny is that? We have to address it. The longer we go on and we just allow greed hell, and I am going to continue to affectionately call it greed hell because that's what it is, and as long as we allow people to do things that are less than unbecoming, more like unacceptable, and especially during a time in human history when so much is at stake, I think it's then and therefore all appropriate for humankind, especially those who have so much to lose, as Americans do, should we fail to meet our time's grave and present dangers. They call upon us so loudly, so clearly. I tell you, if we fail to meet the times, to meet the pressures, we don't have a choice to not meet the demands of our time. It's too serious. All of that is at stake is just too serious. We have to meet these demands, and I think that is what most Americans realize. That's why I'm in this race. My name is Keith Landy. Learn more about your Happy Healer for President. Go to happyhealerforpresident.com, get involved, and do donate. Help out however you can. So important to keep going. I am so proud of those who have helped us get to this point. We are actually on the road now. We are coming to you live from Happy Force One. I hope you like what you see. You'll be seeing a lot of this as I go about this country. But right now we have serious problems right here in Florida. And I don't know if you've noticed it, but I'm going to be showing you, and in quite stunning detail, just how this has been unfolding in Central Florida, all over Florida. And one of the things that you have to recognize about this situation is that it's not just in one pocket here or there. Well, then I guess that we are out of the woodwork. It's just the occasional heres and theres. And that's a danger. This thing in Florida has a very unique capability of going out of hand like in no other place. And I hope that the people that are in charge, I have done my education on this. I've studied. That's why we have to have a president who can understand and dissect and be able to see these issues so clearly. And let me tell you, I see clearly what's happening here. We've got in at least 5 to 10 different hotbeds in Florida already, with expanding cases and more cases coming in every day. And what we have is an perhaps unattainable situation if we don't recognize for the fact of what it is and do something about it, and to tell the people as such that which what it is, so that they can respond to it, that people have the right to know that, and that they have the necessity to know it. And for the rest of us, we must know it. And so I'm going to be helping educate folks on the coronavirus, as well as urging people to respond in a way that is conducive to their lives and to all of our lives, and also be urging our leaders to do certain things and to take certain actions, to be very careful in how we approach this next week even, that we see in Florida such a grave situation. And I want to touch on why I'm so concerned about that. And we have people come in from all over the world. And when you hear about, well, there's a person here or a person there, and that all it takes is one person. When you go back to the very beginning of this virus, which I have learned all about, and even the doctor who first called out that we had a SARS-like virus, coronavirus, on the loose, he was penalized. And his life was unfortunately one of the many lives lost in this battle against the coronavirus. Now, all it took was for one person to get sick, handling this unbelievable process of how they have these fresh markets over there. They're called wet markets. This is where the coronavirus started. It took one person to get sick. In this environment, the entire Wuhan population was put in lockdown. People were pulled out of their apartment buildings. Apartment buildings were welded shut so that people could not get out of the building. People were locked up in this quarantine, as they call it. It was so much more than that in China. The promising news, and there is promising news in all of this, and I'll get into some of those aspects, but now is not the time to talk about the upside to death. And a lot of people are in a risk, especially the elderly. And this is a flu, to think. Typically, when you have the flu, you can go to the doctor and get medicine for it and get better. Many, they don't even go to the doctor, and they just weather the flu out. If it gets worse, then they'll go to the doctor. Well, that's not an option with this flu. And that's basically the difference. And because of that, it's killing off our elderly and people with predisposed medical conditions. And that's what I have learned in my study so far about this virus. So, and you can hear we have buses. They're starting up on the outside here. I am stationed at a bus depot here in Orlando, Florida, and I'll be taking a very close look at this situation. Even some of the buses from this place goes to Cape Canaveral, picking up passengers. They have a daily route there. And so this is really something that is touching a lot of people. And the reason why I'm bringing that up is because in Florida, we see right now people from all over Florida. There's a whole list of it, and I was looking it up earlier. And what is so concerning is how this has been so uniquely attached to the travel industry. Recently, there were 3 employees whose main jobs were assisting the elderly and assisting them with their luggage and wheeling their wheelchairs, helping them get onto their cruises. Well, it turns out that those 3, at least, were diagnosed with the coronavirus. And that's particularly concerning because of the high-risk population that they were in contact with. So there's a likelihood that we have not heard the end of things from Florida, and that we're going to hear about people that are elderly who were in this high-risk population that were needing assistance when they went to these various terminals. Not just one terminal. This company serviced many terminals throughout Cape Canaveral, and so they unfortunately seen a lot of elderly sick people with so much value and purpose in this life Those are the people who are most at risk, and that's what's concerning. So I can't stress to Americans enough, to my friends, and to all people, especially if you're part of the affected group, you're over 60 years of age, you are suffering from an underlying health condition. Those are reasons for you to stay home, to many people call it self-quarantine after they have had contact with the virus. Well, why don't you take it upon yourself to self-quarantine before you have contact with the virus? Because this is very important, and the sick and the vulnerable that won't have the ability to fight this off like many do the common flu even. And so that this is certain death for them. And that's just so incredibly unfair. They never asked for that. And many people can see their end that way. And that's the sad part. We can do so much better. And we have to do better. People are only sick now because we failed to do better. We failed to do our very best. And that's unacceptable. And so that's what this campaign is about. And I am so focused on people and what we need to do. It's offensive that others are not, especially when so much life hangs in the balance. So I told you I've been watching and studying up on this situation and getting very keen on it, and so that I can offer you good advice on what you can do. Also to talk about the trends and to make predictions, and to say stay away from Florida. Stay away from any area that you know is a hotbed of outbreak. You know that it can happen at any moment. Don't go in an unsafe place. I was watching the news today, and there is a guy that was actually coming here on vacation and said, well, if I had only known that the coronavirus was, and his next destination is Key West. That's going deeper into Florida. No, this is not the place to be right now, and especially places of travel. So I say use common sense, and especially knowing what we already know. People have heard, and it's like they don't see what I see, and I know what I see is clear. It's not even opinion, really. It's a real concern. They have 3 people, at least, confirmed to have had this virus already that were working in Cape Canaveral, and they had contact with the elderly. And now if you look at all of the different patients in this corona outbreak and you see who they are, sadly, in Florida, all of them are elderly patients. And I want you to think about that for a moment. How many of them had contact with somebody out of those cruise terminals, or had contact with somebody else who did? Have a look.
50 countries.
Good evening. In the last 15 minutes, a big jump in the numbers. We've confirmed there are 8 new cases of the coronavirus in Florida, and new details on the 3 Port Everglades employees who tested positive for the virus. Tonight, we're learning those employees worked at several cruise ship terminals.
Plus, Broward under a state of emergency with 4 people in the county testing positive for the virus. NBC6 reporter Dan Grossman kicks off our live team coverage from Port Everglades. Dan.
Yeah, Keith, so those 8 new numbers that are COVID-19 positive here in the state of Florida, most of them are from Collier as well as Pinellas County, so on the west part of the state. Here at home in Broward County, officials upgraded the emergency levels to level 2. That is a limited activation, according to the Broward County website, meaning lead agencies will report to the Emergency Operations Center while supplemental agencies will remain on standby. Only hours after Broward County health officials announced a 4th case of COVID-19 in the area, the county commission wasted no time upgrading its emergency activation to level 2.
It opens up resources from the state. They are aware that we're doing it. They have indicated to me that whatever we need.
According to the county website, the decision, quote, initiated preparations due to a significant threat of a disaster or to coordinate response due to the occurrence of a minor disaster. In other words, the county is getting ready to respond, but not panicking.
This is probably the largest, greatest challenge for any kind of health emergency that we've had in Broward County.
From Wall Street to Main Street, the coronavirus is slamming the economy. Small businesses like Rachel's Ginger Beer are in crisis mode.
This is just potentially absolutely devastating.
After Ratcliffe's name was withdrawn for the same job, critics questioning his qualifications then, and now setting up what's certain to be a bruising confirmation battle, Lester.
A busy Friday there at the White House. Hallie, thanks. The World Health Organization sounded a new alarm about the coronavirus today as countries from Europe to Asia impose new restrictions. More on that now from NBC's Kelly Kobiea in Tokyo.
Ship. Tonight, the World Health Organization raising the risk level globally to very high.
Health systems around the world are not ready and need to be better prepared to absorb the impact.
Disneyland. World markets are in a tailspin. Stocks plummeting roughly 4% in China, Japan, and Europe. In Switzerland, the Geneva Motor Show now canceled. The government banning all gatherings of 1,000 people or more.
I mean, you're saying basically expect the number of those who've been diagnosed with the virus to also increase?
It's going to increase. Right now, there's probably hundreds or low thousands of cases.
Hundreds or low thousands of coronavirus cases
in the U.S.
that aren't reported.
Yet. It's a big country, 340 million people, 330 million people. So we can start getting people quarantined and into treatment and prevent more spread. We need to start mitigating the implications of this spread. There was an analysis out today by Trevor Bradford, very good researcher out of the Hutch, looking at the genetic strains in Washington state. And by looking at the strains and the drift between the different strains for the people who have been diagnosed there, he suggested that there's perhaps hundreds and maybe low thousands of cases.
Meanwhile, at the nursing home at the center of Washington state's coronavirus outbreak, officials say 15 residents were rushed to the hospital in a 24-hour period. One resident, 89-year-old Elaine Herrick, died yesterday.
As far as we knew, she wasn't sick. So I was surprised.
The death toll in Washington now rising to 12.
We must prepare this region for the inevitable continued spread of this virus.
This campus will be empty. Students are going to stop meeting here for classes, all classes. Even exams will happen online after a staff member tested positive for coronavirus.
Nationwide, 6 new states, Indiana, Pennsylvania, Minnesota, Kentucky, Oklahoma, and Connecticut, reported their first cases today. Los Angeles, a second medical screener at LAX, has now tested positive, while in Chicago, a 21-year-old college student has the virus after visiting Italy.
Just very mild symptoms like runny nose, headache, cough, difficulty breathing, but no high fever.
In New York State, 22 new cases today and 4,000 protectively quarantined, with New York City officials now pleading for more test kits, telling the federal government limited capacity has impeded our ability to beat back this epidemic.
As unease grows about job security, many workers are wondering if they get paid if they're forced to stay home because of coronavirus. U.S. federal law currently does not guarantee sick leave.
Less than 60% of blue-collar workers get paid time off. We're talking about rideshare drivers, cashiers, and servers. Some say they're scared of catching the virus because they work face-to-face with customers and they don't have the option of working from home.
Some basic tips. A box of tissues. Use one if you have an itch. Try to occupy your hands. A clean stress ball could work. Use a hands-free cell phone. And the best strategy? Clean hands. Just keep washing them. Stephanie Gosk, NBC News, New York.
Is that you need to stay home when you're sick. That if you've traveled, even if you haven't traveled, now is the time. We are in an extraordinary situation. We need everybody to be aware, to look after their children, to understand if you or your children are sick, stay home, isolate yourself, let your body recover. If you have concerns about exposures to COVID-19 or you develop more severe symptoms and need to have a medical assessment and medical care, then please call ahead and we can get you that care. If you have people in your gathering who are elderly, who are more who are more susceptible to having severe illness from this disease. And if you are going to get together, let's look at refraining from our usual greetings. Now's the time to put some distance between us to keep our germs to ourselves.
Whatever it was an animal. It jumped from an animal to a person. It's a wild animal that's been taken out of its natural environment, consumed in some way, come into contact with people in an unnatural way. That's the lesson here.
Do you find it mystifying that you can have a grandparent dying in an aged care home in Sydney from an animal that was sold in a market in China?
Yeah. No, it's incredible. I have to say we're not surprised because we've been working on this for years. We've been trying to warn people that, this is global.
We're walking into the heart of Bangkok's immense Chatuchak market to see how seriously Thailand's authorities are taking the threat that coronavirus has so dramatically exposed. Here in hot, squalid and cramped conditions, wild animals smuggled in from all over the world.
I think of this place as a torture chamber and a filthy laboratory all mixed into one.
From AIDS to SARS. If coronavirus is the disease X the world has been fearing, then it possibly began somewhere like this, among a colony of bats.
And panic is no good for any kind of outbreak control.
How was this virus born? What was the mechanism that gave birth to it?
Probably a zoonotic jump, that is from a small mammal, likely reared or captured at least for food consumption.
The coronavirus is coming for Trump's presidency. Plus, we sent Morning Joe's chief medical correspondent to Washington over the weekend for a first-hand look at the government's response to the outbreak. We'll show you that report next.
New case of coronavirus in Volusia County. Okay, we have the full list right here.
The coronavirus effect has been fast and devastating for the airlines. Planes half empty with business and families canceling travel plans.
Scientists here are creating pseudo-coronavirus, meaning the virus minus its ability to replicate, allowing them to leverage what they believe is their secret weapon, mice housed in these protective structures whose immune systems have been genetically altered to mimic those of humans. The brainchild of George Yancopoulos.
With the idea being that you could challenge these mice with any disease, potentially get an immune cure.
In a typical vaccine, like the flu shot, for example, the injection contains a small amount of the virus to cause your body to develop antibodies against it, but that can take weeks. In this case, Regeneron essentially exposes the mice to the pseudo-coronavirus. They then create the antibodies that, when delivered to humans, provide immediate protection.
Well, one thing I want folks to know is that we have been looking at the data from around the world, and we now know more than we ever have about who is at risk. Who is at risk, and I hope you will help us communicate this to the American people, are people over the age of 60. They're much more likely to develop complications from the coronavirus and to be hospitalized from the coronavirus. The average age of death is age 80. Now, what we also want communities to know is that if you are a child or young adult, you're more likely to die from the flu, if you get it, than you are to die from coronavirus. So there's something about being young that is protective. We want people to be reassured by that. We want people to know that we are really focusing in on those groups that are at highest risk for complications and helping them understand how to be safe. And this new advice that's going to be coming out tomorrow is designed to keep our community safe, to help keep the most vulnerable safe. And it's important to understand that even though young people aren't at risk for dying from coronavirus, they can potentially spread that to older people in the communities and people with chronic diseases. So it's important we all take precautions, washing our hands, covering our cough, keeping our distance from people who are sick, and taking the steps that will be coming out in this new guidance to help make sure we're doing everything we know possible to keep our most vulnerable protected.
Having a news conference tomorrow to talk about various things that we're doing economically. They'll be very major, including obviously the payroll tax cut. And so we'll be meeting again tomorrow afternoon. We'll be coming back from the Senate. We have a lot of very important meetings set up. And we'll have a press conference sometime after that. and we'll explain what we're doing on an economic standpoint and from an economic standpoint. But they will be very dramatic, and we have a great economy. We have a very strong economy, but this blindsided the world, and I think we've handled it very, very well. I think they've done a great job. The people behind me have done a great job.
I'm really looking forward to talk to Craig, though, because he's got quite the story.
He has quite the story. But our first question is basically a week later since we first heard from you, Craig. How are you doing?
I'm asymptomatic. I don't have any fever. I don't have any lung problems. My temperature is normal. I've had 2 tests. I'm waiting for the results, and they are the CPR, which is poly chain reaction. And I need 2 of those negative tests in a row in order to be released from the hospital.
Okay, you still haven't had those yet.
I've had the test, but I'm getting the results hopefully in 2 days. They test for 4 days ago. It takes 2 or 3 days for them to go to the lab and then give me the results.
Okay.
It's really quite comfortable. Unlike the ship, where we were confined to our rooms a lot, and we were given permission to go outside once a day for an hour at a certain time, I can wander the corridors of this hospital, the 5th floor only, anytime I want. The nurses have with them an iPad which has a translator on it. So if we want anything they don't understand, I speak into it and then I get the answer from them through the computer.